So we're going to get into what is red light therapy. So this is a question that you probably ask yourself, that your patients are going to ask you. So it's important to have an answer. And red light therapy, it's also known as photobiomodulation therapy, low-level laser therapy, low-level light therapy, low-intensity laser irradiation, low reactive laser therapy, cold laser, non-thermal laser, soft laser, biostimulation laser, photobiomodulation laser, or even light-emitting diode LED therapy and organic LED therapy. So there is a wide range of names for red light therapy. So if you're looking up the research, so in the scientific community, it is definitely best known as photobiomodulation or low-level laser therapy. So if you're looking up research articles, I would recommend searching those terms there. But a lot of your patients or clients that you work with are going to simply know it as red light therapy. So this is the general term that refers to the therapeutic approach based on photobiomodulation principles that cause biological alterations in organisms, secondary to interactions of photons in the visible and invisible. So visible is red, invisible is the infrared or near infrared light spectrum with molecules in the cells or tissues. And that's from Hamblin. So one of the top books that you could get, it's from Michael Hamblin. It's called Low-Level Laser Therapy. I got a copy of it. So I will include a link to the book by Hamblin, which is an excellent resource. And I'll include it here with this module. So that way, if you want to purchase it, you can. I highly recommend it. He gets much more in depth in this book than what I'm going to get to in this course, but he gets very in depth. So how does red light therapy work? And this is what a lot of people ask. This is what we're going to talk about, and you need to be able to talk about this with your patients and clients. So red light therapy works by the absorption of red and near infrared photons. So those specific wavelengths, they activate the cytochrome C oxidase in the mitochondria. This activation of the cytochrome C oxidase leads to an increase of mitochondrial membrane potential, an increase in oxygen consumption, an increase in ATP, an increase in reactive oxygen species, and an increase in nitric oxide. So with that being said, basically what's happening is red light therapy has this huge cascade of effects. And basically what we're doing is we're making the mitochondria more efficient at producing ATP and energy. And since the mitochondria are in a wide variety of different cells and systems in our body, that's why it can have a systemic effect. So not only is it going to help these people lose weight, it's going to help them with pain relief. It's going to help them with inflammation. It's going to help their body become more efficient at producing energy by having an effect on these mitochondria and ATP production. And the nitric oxide production, that's also going to help with increasing vasodilation. So that's where you're going to get an improvement in circulation and an improvement in the cardiovascular response. So there's also transcription factors such as nuclear factor kappa light chain enhancer of activated B cells that are activated, leading to signaling pathways that promote cell survival, cell proliferation, and cell migration. And that's sources of Qi. So there is an improvement in these cell survivals, cell proliferation, and cell migration, which again is going to help with overall age and anti-aging, reverse aging, that kind of thing. So some general terms to understand when you're working with this is wavelength is obviously a big one. So wavelength is the light that consists of electromagnetic energy with wave-like properties. So this is expressed in nanometers. And the visible nanometers are so from the 400 to 750. And so when it comes to red light therapy, this is typically in the 600 to 1,000 nanometer range. So 600 to 750 is typically going to be the visible. And what you're going to see in the research is most of the therapeutic wavelengths are in the 600 range and the 800 range. So is where most of those wavelengths are. Not typically anything in the 700s that you're seeing anything. So if you see any devices that are using 700 wavelength, there's really not research to support that as being one of the wavelengths that are therapeutic. Power is a big one to know. So power is measured in watts, which is the energy or joules per second. There's a peak and average when it's pulsed. So if there is a pulsed power. The beam area is measured in centimeters squared. Now, this oftentimes, when it comes to the beam area, it's very hard to measure. So a lot of the sources that are measuring the beam area or the centimeters squared, it's not very reliable in a lot of the resources, according to Hamblin again. The irradiance, which is the power density, which is watts per centimeter squared. This is a big thing to know. Again, since the beam area is difficult to know, there's a lot of discrepancy here, and it's might not be very reliable as to what these some of these manufacturers are claiming. And that's because the beam area specifically, it's in an elliptical, just the shape of it. And so that's why there's some discrepancies and difficulties with actually measuring that. So the irradiance is going to have an effect on, whether the successful tissue repair and anti-inflammatory effects are from that 5 to 50 milliwatts per centimeter squared at the target tissue depth, and irradiances of 300 to 1730 milliwatts per centimeter squared are required for analgesia to inhibit the nerve conduction in C fibers and A delta fibers, according to Hamblin. When it comes to treatment time, there is typically a treatment time anywhere with the research done from seconds to minutes. A lot of these manufacturers, when it comes to weight loss, are recommending anywhere from the 10 to 20 minute range. And that's going to depend on the device. It's going to depend on the amount of power. So it really depends on what device it is that you have with regards to treatment time and how long you're going to want to be treating these people for. I use a trifecta light, so we're typically, I got a set of pads and a bed. So it's going to depend. If they're on the pads, we're recommending 20 minutes. And if they're on the bed, we're going to be recommending a shorter time period, 10 to 15 minutes. Usually we do 12 minutes. And some of the research on red light therapy for weight loss, very interesting. There's a lot of research out there. Some of it, I'm not going to deny, it is mixed a little bit, but there is some very positive research on the benefits of red light therapy in helping and aiding weight loss. So Niera et al. Is one of the studies that they sampled human adipose tissue from 12 lipectomy patients who operated with and without tumescent technique and externally irradiated with a 635 nanometer 10 milliwatt diode laser. And they found that with 4 minutes, 80% of the fat was released from adipose cells. And with 6 minutes, almost all of the fat was released from the adipocyte cells. So very interesting. And then the group without the tumescent technique, and what they found that there really wasn't any change. So pretty positive research on that one study there. So next is the research on body contouring. So red light therapy has been shown to be beneficial in helping with body contouring and helping to lose inches. And from what I have seen, this is where it's really helped quite a bit, even more so from weight loss, is the body contouring aspect. So a lot of different research out there. We're going to hit on several of these studies, 5 different studies. So one of the first ones was this article by Jackson, Dido, Roche, Turek, and Maloney. It involved a Zerona lipo laser. It was a placebo-controlled, randomized, double-blind, multi-site clinical investigation involving 67 participants. And this was really one of the first studies that showed that red light therapy, photobiomodulation, was effective in body contouring. It was a really good study. So this device that they used was the Zerona lipo laser. It emitted 17 milliwatts of 635 nanometer laser light. And they demonstrated an average reduction of 3.51 inches across the patient's waist, hips, and thighs in 2 weeks. So this clinical trial also, what's important about it is it was absent of any dietary restrictions or exercise requirements or any other adjunctive components. So it really just focused on the lights and not involving, diet, exercise, that kind of thing, and having the patients do that. Another study that was done by Caruso Davis, it was a randomized control trial. involving 635 to 680 nanometer lights. They did 30-minute treatment times for twice a week for 4 weeks on 40 healthy young men and women. They were asked, these subjects, not to change their diet or exercise habits. And they showed a significant reduction in their girth loss at the end of the treatment period. And then another study, Jackson et al., demonstrated a significant reduction, overall mean reduction in 5.17 inches across all measurement points and circumferential measurements for the waist, hips, and thighs. They had 689 patients. And so this was following the low-level laser therapy with the Zerona lipo laser. The treatment period was 2 consecutive weeks, so over 2 weeks. They did 3 treatments per week, every other day, for a total of 40 minutes. The authors also noted that circumferential reduction exhibited following low-level laser therapy was not attributable to fluid nor fat relocation, since all measurement points, including non-treated regions, reported an inch loss. So pretty cool there. And then another double-blind study, controlled randomized control group, using 635 nanometer wavelength and reducing upper arm circumference of, this is a group of 20. They demonstrated a significant progressive and cumulative treatment effect compared to the sham group, following 6 treatments with no side effects. And then lastly, this last study using 635 nanometers, they did it every other day for 2 weeks, 20 minutes of treatment for both anterior and posterior, and they had an average reduction of 2.99 inches reduction in waist, hips, and thighs. However, this study lacked a control group, so not necessarily the best there. And they also had administered dietary supplements, and so, not necessarily the best, because they did add some other things and they didn't have a control group there, but still showed loss, which is positive. So pretty good research here showing that really low-level laser therapy, photobiomodulation, red light therapy, whatever you want to call it, has good results in body contouring. And what I have found, just with my experience, is that what I tell people, they can expect to lose a 1/2 inch to 2 inches per session. Now, I always recommend too, hey, if you're doing it for weight loss, let's change these other components too. So again, as far as making sure that you're eating healthy and living a healthy lifestyle, so educating them on this. However, this is the research regarding body contouring. So who would benefit from red light for therapy for weight loss? So really, I say this is for any adult men or women who are obese or looking to lose inches. This is really good for body contouring. Looking for an adjunct to diet and exercise. These people who maybe they live a sedentary lifestyle and they're looking for something else to help give them that boost. This can be for them to help give them that extra boost that's safe and effective. Now, I always tell them, hey, this is best done in conjunction with diet and exercise, because me personally, I want them to incorporate those other things. I want them to live a healthy lifestyle. And as a physical therapist and healthcare professional, I believe that healthy lifestyles involve everything as far as diet, exercise, nutrition, sleep, all of those things. So those dealing with anxiety and depression, though, as well, those individuals, red light therapy has been shown to help treat anxiety and depression. If they have pain limiting exercise, red light therapy is going to be great for them, because red light therapy is also going to provide an analgesic effect, and it's going to help with that pain and inflammation response. So if they're limited by exercise due to pain, this is great for them. For those looking to avoid bariatric surgery, red light therapy is for, in addition to those, I didn't put this on there, but those who have had bariatric surgery. I've had good results with those who have had bariatric surgery, and maybe they didn't get the effects that they wanted from bariatric surgery, or they want to take it a little bit further. Red light therapy has been really good. Those looking to tighten and tone due to the effects that it has on the skin, as well as losing inches. And then it's also been shown to help reduce cellulite. So those looking to spot treat and get rid of some of that cellulite on the legs, especially for those women out there looking for those effects. Contraindications and precautions. This is always a big one, right? 2 big ones, pregnancy and cancer. Really, that's about it. If they're worried or they have a huge laundry list of past medical history, always recommend them to follow up with their MD, their primary care physician, and just say, get the confirmation. But the two ones, pregnancy and cancer. So women who are pregnant, I'm not going to mess with it and recommend it. Just, you really want to be careful there. And then cancer, this is an interesting one when it comes to cancer, because there have been studies on photobiomodulation with cancer and it helping with the side effects of chemo and with it also possibly helping cancer. However, you want to be, I'd rather be safe than sorry. And one of the worries is with it increasing the production of ATP, if you have a malignant cancer, making it worse and spreading. There hasn't really been anything to show that. However, this is a contraindication and precaution. So again, if they have cancer, I would recommend that they follow up with their physician before undergoing this. So always screen for those two things. Parameters for red light therapy for weight loss. This is really going to vary based on the device. So it's going to depend on several things. It's going to depend on what wavelengths you're using. Are you using red or near infrared? What's the power output? And what does the manufacturer recommend? So this is really going to, unfortunately, vary depending on those factors, on how much power the device has, what the wavelengths are that they're using, how many LEDs there are. All of those things play a role. So it's really going to vary depending on the devices. A lot of the devices and manufacturers that I've looked into and talked to, they're recommending typically anywhere from 10 to 20 minute treatment sessions for weight loss, again, depending on the device. So a lot of like your red light therapy beds, it's typically 10 to 15 minute range. Your pads, they're recommending a lot of times 20 minutes. Again, sometimes though less is more. So going back to that biphasic curve, if you do too little, you're not going to get an effect. If you do too much, you're not going to get an effect. So you really want to check with the manufacturer of your device on what they are recommending as well, and then looking into the research too.